It seems to me that we have assumed for today's hearing that there will be a public option. That may not be true, but let's talk about it as though there's going to be a public option. My problem with a public option is how to design it so that it does not become a dumping ground for the problem cases of the insurance industry that they want to get rid of. And I would like to ask whomever, maybe Dr. Reinhardt or Bill can start, if Medicare was made the public option, what would be necessary in national insurance regulation to prevent the private companies who want to dump their people who are problematic into either the private insurance companies or the private manufacturers into the government plan? What would you have to do to make that so it would actually work?
Well, most other nations that have only private insurance options, or they could have a public one, use a risk adjustment mechanism. Germany quite explicitly does that. So after the enrollment period is over, they assess the risk that each plan ended up with and then have compensation payments. That is, plans that end up with younger people, healthier people, make a payment to this risk fund, and plans with sicker people get a payment from that. So if you had an insurance market with a public plan and private plans, you would use that same mechanism. The Dutch do it, the Germans do it, I think the Swiss do it as well. And the risk adjusters you need for that are pretty well understood now by health services researchers. But that's the most practical way to deal with it. So if the public plan actually ended up with a sicker risk pool, private plans with a healthier pool would have to make a payment so that the risk pool would be equalized. I actually talk about that in my state. You see, the playing field issue is not just payment, it is also the risk pool you end up with. Those are the two things. And the risk pool gets equalized in these other countries by having this compensation mechanism.
Is it your view that the creation of a public option like Medicare for all would force people out of the private industry? As we've heard this number, 30% would be forced out of their private plan and into the public plan. Is that your understanding of such a plan?
Well, that's the language that gets used. Lewin doesn't use it, the Lewin group, but imply it. What that would mean is that many employers simply say we will no longer offer public employer-based insurance. Of course, those employees then would still have a choice of the public plan and private plans that sell individually based insurance. So I find that argument specious. I don't think the word forced is the correct English here, because yes, you wouldn't get it from the employer anymore, but you would still be able to buy private insurance in the individual market, a restructured market. I've never understood this scenario. I don't simply buy the scenario that a public plan would ultimately squish the private plans out of existence. And the argument I've heard at Galen Institute makes it that the public plan will then deteriorate and give very low quality care, and they paint the Canadian system. But if there is the option of a private plan, even if they had shrunk initially, they would grow again. I mean, these people don't seem to understand how markets work. And I'm an economist. I cannot believe that if a public plan really didn't play well by the American people, that you wouldn't have immediately a private insurance industry growing out of the ground offering them a better deal. Isn't that how markets work? So somehow there seems to be a lack of faith in the market in this.
Mr. Vaughan?
Just the thought is that it does become a bit self-correcting in that no, Medicare can't get too out of line with the private sector. You get access problems. And I think you guys have done a great job trying to protect Medicare. The doctor fix that goes on year after year. You're not going to let doctor pay get too far below where it is, and sure, it's below, but it doesn't get too far out. And if it started to, you guys would either come in and protect the Medicare beneficiaries. So in a sense, there's a limit to how much Medicare can become cheaper and so attractive to people that they'll all leave the employer system.